everybody doing? Good. We got to do a little rearrangement here. Let's do some of this right here. There we go. Good. First of all, let's give it up for Anthony McCarthy, okay? Radio personality, SMD, and to President Tracy, thank you for your leadership of your respective organizations, the difference that you make in the community, whether it's championing civil rights, whether it's being mentors for young ladies, the work that the AKs do in our schools, in our community. I really appreciate it. Thank you very much for hosting this evening. How's everybody doing?
All right.
It's great to be here this evening, to be able to spend a little bit of time with you. I hope to keep my remarks brief, because I want to open it up for questions so I can make sure that we are speaking to the issues that are important to you. You know, I'm about a generation removed from poverty. My father was raised in Kingston, Jamaica, in a poor neighborhood called Jonestown. He was raised by his grandmother in a very loving, caring home. It was a one-bedroom home with a dirt floor. And it was tidy and it was neat, and there was a lot of pride in that house. It was surrounded by a community full of hardship and poverty, illness and disease, much of which never went treated. And when my father was a little bit older than my son Jonathan is today, he wrote a letter to his mother, my grandmother, who was already in this country. And he said, "Mom, bring me to the United States. So I want to go to college." He saw a lot of sickness. He said to his mom, he said, "I want to heal people. I want to be a doctor." My grandmother wasn't a wealthy woman. I know my good friends Doug and Nat Oaks and Senator Glad, they've heard me share this story, because it's this story that has inspired me in public service. My grandmother was a domestic servant. She worked for wealthy families. She helped raise their children, prepare meals for their families, and clean their bathrooms. She was a proud woman without an education, but she knew the importance of an education, so she saved her money. She brought my father to this country. He was the first in our family to get a college education. And then he spent his entire life, after graduating from medical school, he was a family doctor, seeing patients, treating people in some of the poorest neighborhoods and hospitals near where I grew up when I was a little boy. My father loved his patients. What he didn't make in salary, although we were comfortable, was made up for the satisfaction he got knowing that he made a difference in the lives of his patients. I knew growing up that I wanted to be like my father. He taught the lesson of service, neighbors helping neighbors, taking care of others, particularly those who are in need. So I didn't go to medical school. I went to law school. But as a lawyer, having spent 30 years in the Army on active duty and in the reserves, as a member of the General Assembly, and most recently 8 years as your Lieutenant Governor, I've had the opportunity to work with communities around Maryland, around the state, as we have fought to build the best schools. And we know the work needs to continue, because not every child today yet is in a blue ribbon school, so our work continues, and that's why we invest $1.1 billion in the Baltimore City School to replace and renovate 35 schools by 2018. We've got some of the best hospitals, not only in the country, but in the world, deliver outstanding medicine and discovery, like an NIH in Montgomery County. Yet our work continues because we still have some Marylanders, whether by race, ethnicity, or geography, aren't getting the same health care and living the same healthy quality lives as their neighbors. So this is a great state, and we've made a lot of progress. But I'm running for governor because, like you, I believe that we can build a better Maryland, and we've got to build a better Maryland for more Marylanders. Because each of us contributes to the greatness that is this state, so each of us should benefit from the greatness that is Maryland, because Maryland is a great state. I'm happy to be here this evening to be in a conversation with you about how together we can build a better Maryland for more Marylanders. So with that, let me stop. Anthony promised that he had a whole bunch of questions. I hope that we can get to as many of them as possible.
Before, and I'm not going to take it away from our Lieutenant Governor's time, I did want to recognize and please honor Delegate Nathaniel Oakes, who is in the audience. Delegate Sandy Rosenberg is in the audience. Welcome. And Senator Lisa Gladden, welcome, Senator. Great to have you here. Lieutenant Governor, there are a lot of questions. Some of them surprisingly are repeats, but we're going to go through these questions. We are in a senior center. What is your platform to do more for seniors in the state of Maryland?
Sure, there are a number of things that we can do for seniors. And you know, it's interesting because a few years ago, when I visited a seniors center, I started talking about a lot of issues that are somewhat unique to seniors. And one of the seniors raised their hand and said, "Young man, will you stop talking about seniors? You're making me feel old. I want to hear about education because I got grandchildren. I want to hear about jobs because I got children. I want to hear about safe neighborhoods, which isn't a senior issue, but it's an issue that affects each and every one of us." I said, "I got your point. I got your point." Well, look, there are a number of things that we need to do to ensure that we are supporting our seniors. These are men and women. These are our Marylanders, our neighbors, who have already contributed so much and have many more years to go to continue contributing. That's why recently I proposed an affordable housing plan in Maryland. Many seniors struggle with affordable housing as they go from an income to a no income or a flat income that may only be Social Security. And we have a demand for affordable housing, whether it's seniors or military, veterans, workforce housing, and seniors are acutely impacted by this. So I've rolled out a plan for affordable housing to invest more dollars that we can use, public dollars to leverage private sector investments to deliver more affordable housing. And seniors are a big piece of that. Look, we just implemented the Affordable Care Act. And you remember years ago where we were wrestling with the Medicare prescription drug Part D program that left that gaping hole for seniors? Remember? So seniors, for the first few dollars they spent, they only paid a copay, but then they got to a certain point where they had to pay all of it, only until they reached a higher level, they got back to the copay. That donut hole was very difficult for our seniors. So as part of the Affordable Care Act, see, often lately, what we've been reading about the Affordable Care Act is a broken website. But let's not lose sight that the Affordable Care Act has delivered so many benefits to so many Marylanders. Parents who can no longer be denied coverage because their child has a pre-existing condition or they're no longer paying through the roof. None of us can be thrown off of health care because of our claims history. Well, for seniors, and we embrace the Affordable Care Act, one of the important protections is to close that donut hole in the prescription Part D program. Look, I see an opportunity for seniors, whether it's working with the AKA, the NAACP, or the Governor's Office of Volunteerism, to engage seniors, to work and give back in our schools, in our communities, to use their talents and their skills to continue making a contribution to Maryland. But one thing I know for sure, regardless of the age, and I learned that a few years ago, I told a different senior, reminded me not to remind her how that she's not as young as she used to be. Marylanders all want the same things for themselves and their families: safe neighborhoods, great schools, a clean environment, and access to affordable, quality medical care.
Thank you, Lieutenant Governor. Your administration touts its commitment to minority-owned businesses in Maryland and in the city of Baltimore. I'd like to know specifically what you will do to increase that number of minority-owned businesses, because we know they still need support.
Absolutely. Great question. Maryland is home to perhaps one of the most diverse business communities. We have the highest, or one of the highest, percentages of women-owned businesses in Maryland, and that's true for African-American owned businesses. And these are businesses in all sorts of industries, from the retail side, cosmetology, in the hospitality industry, the construction industry, in cybersecurity, in the life sciences. A very dynamic, capable business community. The governor and I recognized that 8 years ago. And when we took office in our Minority and Women Business Enterprise program, we had the structure in place for a good program, but we didn't have the leadership, the will to make that program work.